Good morning, everyone, and welcome to today's session titled Trauma-Informed Youth Work. This is the first session of our new Ready to Enhance Project Echo series from Ohio Adult Allies in partnership with the Ohio Center for Excellence for Behavioral Health Prevention and Promotion. This series is designed to equip adults supporting youth community leaders with the tools and insights needed to effectively empower youth. Through 5 monthly sessions, this series will address critical topics to enhance communication, foster supportive environments, and build cultural competency while promoting youth leadership and mental well-being. Together, these sessions provide a comprehensive framework for addressing the work and advancing the work of Ohio Adult Allies who seek to encourage youth empowerment. My name is April Schweinhart, and I have the pleasure of supporting this series. Just for some context, there are approximately 1,300 hubs in over 200 countries running echo sessions, not unlike this one. And I am so proud that we are leveraging this model to bring an innovative prevention resource to people in Ohio. This Echo Hub is facilitated by team members from the Ohio Adult Allies and the Ohio Center of Excellence for Behavioral Health Prevention and Promotion. You can visit each organizational website to learn more about the work. Both the Center and Ohio Adult Allies initiatives are funded by the Ohio Department of Mental Health and Addiction Services and administered by Ohio University's Voinovich School of Leadership and Public Service in partnership with the Pacific Institute for Research and Evaluation. Whether you're new to the ECHO model or have experienced one of the center's other ECHO sessions, I think it's probably most important to understand the core philosophy of all teach, all learn. In each session, we will start with a subject matter expert providing a didactic on the identified topic. But what makes ECHO so special and mostly effective is the core value that everyone in the room has knowledge and experience to make a valuable contribution. And we can all learn from the work of our community members. Collectively, the wisdom is already in the room, and I'm talking about you. So why the ECHO model? Some of the benefits of the ECHO are listed here on the slide, and we won't spend too much time talking about them, but I wanted to highlight that this model democratizes information and expertise for the public good. It helps to build workforce capacity and ultimately improves outcomes for communities. Just some practical tips for today. Please make sure to mute your microphone when you are not speaking. I know that we are approaching lunchtime or you might be finishing some morning snacks, but please turn on your camera if possible. We'll all provide you grace, I promise. These sessions are really intended to build connections and relationships between us. I encourage you to use the chat feature throughout the session, and particularly if you want to share resources or insights relevant to the discussion. I'm so happy to see everyone here today. We can also use the raise hand function if you want to join the discussion, but feel free to just unmute as well. Please, if you have them, turn off your AI note takers. And if you're experiencing any technology issues, we have the wonderful Nancy Clough on our hub team who you can reach out to in the chat or at her email, which is listed on the slides. Speaking of the hub team, you can identify us all by this wonderful white background with the multiple ECHO, Ohio Center of Excellence, and Ohio Adult Allies logos on the back. As the hub team, we are committed to creating an inclusive environment and providing all necessary accommodations. We will start and end sessions on time and work hard to make good use of your time by providing quality content. The only recorded part of our sessions is right now and the didactic presentations, and this is out of respect for your privacy and the community members you serve. We will provide continuing education credits, which you can earn by completing the evaluation after each session. We also have commitments we ask from all participants. Please help us keep a safe and respectful learning environment by valuing the opinions of everyone on the call, using inclusive language whenever possible, and protecting the privacy of everyone involved by keeping discussions confidential. We want you to feel comfortable and open in sharing your experiences, knowing that this is a supportive space. This is also just a final reminder about other upcoming sessions for this ECHO, as well as the other ECHOs from the Center of Excellence. For this series, we'll meet monthly on Tuesdays, but we also have our Advanced Prevention Practice Echo that meets every third Friday of the month. And you have your last chance to attend the Youth Vaping or Adult Low Risk Drinking Echoes by following the QR code on the slide. With that, I would love to introduce our presenters today, Drs. John Ackerman and Amberly Prater. Dr. Ackerman, is a clinical psychologist and suicide prevention clinical manager at Nationwide Children's Hospital in Columbus, Ohio. His team trains schools, healthcare agencies, and youth-serving organizations throughout Ohio to identify, assess, and establish safety plans for youth at risk for suicide. Dr. Prater is the clinical and lead supervisor for the Center for Suicide Prevention and Research, also at Nationwide Children's Hospital. In her role, she provides clinical care to adolescents and families, coordinates implementation of suicide prevention programming in schools, provides community-based suicide prevention trainings, and supervises and supports hospitals' Zero Suicide Initiative. Welcome so much, Dr. Ackerman and Dr. Prater.
Oh, thank you very much, April. Really appreciate the OA team and the Ohio Center for Excellence for having us here talking about what we think is a very important topic, and that is engaging in trauma-informed care with a specific emphasis on suicide prevention to give folks a working model, and look forward to hearing from Evie Roberts a little bit later today. We want to make sure that we are able to sort of take this trauma-informed approach that we use with suicide prevention and use as a model for some of your work. Next slide. Very briefly, where do we come from? We're at the Center for Suicide Prevention and Research at Nationwide Children's Hospital, and we train schools and community organizations on how to implement suicide prevention work with young people as effectively as possible using a trauma-informed approach. We need to reduce stigma, increase awareness, and make sure the community is engaged in this work. So we'll talk about how that fits with the model that we'll be talking about today. We also want to make sure that adults who work with young people are as prepared as possible and understanding of the importance of maintaining safe, effective relationships with them, young kids. And ultimately, the work that you are doing ends up being important to preventing suicide. And our mission is that we engage each community member to understand their role in preventing suicide. So I think it's a good fit for today, and look forward to having this discussion. Feel free absolutely to put questions in the chat as we go along, and myself and Amberly will respond to them. A few basic objectives of today. We want to learn about what is trauma-informed care. What do we think about when we think about trauma in general? Provide a primer for that, and then talk about how the body and mind might respond in situations where trauma is prevalent, and importantly, ways that adults can respond to individuals who may have experienced trauma, and how to create an environment where this work can be done effectively. I want to learn about youth suicide very briefly, talk about what are the warning signs, what do we look for, how do we respond, and what are the risk and protective factors to make sure we can support young people, and then discuss the role of trusted adults in doing this work. How do we provide support? How do we set boundaries? How do we create a culture that values youth mental health and that values the voice of young people in the most impactful ways possible? Next slide. So when we talk about trauma-informed care, we need to first start out by understanding it's not just a set of tools or words or skills that one uses. It's an entire approach. It's not a specific treatment. It's an awareness and knowledge of how trauma influences behaviors. It's about setting the stage, creating an environment, and welcoming young people in a psychologically safe manner. Really like this quote because it encapsulates a lot of what we do. The kids who need the most love will ask for it in the most unloving ways. What this means is sometimes when a young person's experienced trauma, the way that their body internalizes this, the way that their brain responds and their emotional world is regulated doesn't always look like the way adults would want it. So our job is to help understand how young kids are expressing themselves, and whether we, as support systems, as guides, as anchors for young people who have gone through trauma, can really allow them to behave in a way that's supported and safe, and lets them feel more supported and empowered in the work that they do. And this will eventually lead to a much richer environment for them to learn, to grow, and to be part of groups. Next slide. So when we think of trauma, it gets overused a lot, especially in our everyday ways of speaking. Everything sometimes that feels negative is trauma, but trauma actually is a specific event or situation. It's frightening, it's dangerous or violent, and it poses a threat to the child's life or bodily integrity. So this means that anything from an actual physical event, loss and life-threatening event, or whether it's something that's witnessed, or whether someone they know or love is impacted, these can all be traumatic. And then toxic stress is prolonged, ongoing exposures to trauma. So some of the ideas here are that trauma can be a major sort of worldview altering experience, or it can be an ongoing set of exposures to very difficult, challenging environments that pose a threat to an individual. There are a lot of specific ways that trauma can unfold. In the interest of time, I'm not going to go through every one of those, but you can see a range of these situations involving loss, a major change in one's life, their expectations of the world and the safety around them are things that often engender a trauma response. Next slide. And the way that young people react to trauma are different based on who the individual is, how they respond. There's not a uniform response, but there are some themes, and there are some ways that trauma tends to impact a young person in a consistent way, and it does impact lots of elements of their physical world, emotional world, the behaviors they express, and the way that they think. So if we think of physical, challenging sleeping, really the body is aroused, overwhelmed. You see actually increases in hormonal responses such as cortisol, appetite changes, the body. Think about when you've been the most frightened or afraid, your body goes through immediate changes. But the challenge with trauma is those changes tend to last a lot longer than is helpful for the individual. So the things that happen to a young person physically, emotionally, behavior, and cognitively, instead of lasting for just one period of time, it lasts in an ongoing way because their safety and their way of viewing the world really doesn't reach the same baseline. It would be like if you had maybe you had a car alarm that was meant to protect your car, but if it goes off one time or maybe a couple of times when it's meant to go off, that's a really effective alarm bell. If it goes off all the time, chronically, never stops, it ends up being a very unhelpful tool, and it ends up not only depleting the car's battery, if we're going to use that metaphor, but no one responds to the actual risk in the way it was meant to be responded to. So we have a need to respond to very dangerous situations in the world, but in the case of trauma, it's often acting in a way that becomes super unhelpful for the young person, and over time they build patterns of seeing the world, of emotional responses and behaviors that no longer work for them. So from a treatment perspective, which Amberly will talk about more, there's ways to support this re-establishment of a baseline that's helpful for the young person. The emotions that you'll see often being angry, irritable, sad, overwhelmed, very hypervigilant, seeing a threat in things that are maybe neutral or non-threatening, always reacting in a way that is reflective of that fear, of that expecting of bad things to happen. Behaviors can be disruptive, disorganized, tearful. It can look a little bit like impulsive or ADHD-like behavior, challenging connecting socially, and trouble processing information. If your mind is focusing on a fear, if you maybe thought there was a tiger outside of your door, you probably would be not focused totally on your math homework, or you might be seeing a little bit less attention in those areas that attention is typically warranted. So it can look a lot different to adults, and they may feel like kids aren't paying attention. They don't want to be there. They're disruptive, all these things. And our job is to help reinterpret some of that information and make the environment more manageable for young people. So that goes to the last line. Trauma doesn't make it okay for kids to behave poorly, to be disruptive, to be hurtful, these types of things. But understanding the effects of trauma can help us respond to challenging behaviors in more effective ways. Looking at the behavior as an ineffective way of a young person getting their needs met. And our job is to help that young person see that they could be more effective, that with support, with guidance, and a new environment, their behaviors don't have to stay the way that they thought they needed to act in different situations. Next slide. Okay, a little bit busy slide, but this will be used primarily as a resource. There are some ways here that I want to highlight. One of the most important things I think Amberly are going to leave you with today is that when we're dealing with past trauma of a young person, one of the most helpful things we can do is to help establish a psychologically safe environment. What does that mean? A young person is free to be themselves. They're free to express their emotions. They're free to connect and feel like they have an impact on the world. When you've experienced trauma, many times you feel like things are hopeless, that you're helpless, that you don't have an impact on the world, you're not valid as a person, all those things that may have happened to lead to trauma in the first place make it difficult for you to trust, to grow, to connect. So creating a psychologically safe environment means let's build that culture of safety and trust. How do we make sure everyone in that group has established rules and guidelines and ability to work together with others? Can we make sure that we are non-judgmental? We're not attacking. We're letting people be themselves, and who they are is special. And we need to celebrate that, and that we have opportunities to debrief. We make sure our communication, which I'll be very brief here because Amber Lee is going to talk about that, is supportive of an individual, and make sure that dysregulation can be organized in a helpful way. We have peer systems where young people are structured in a way that they can create new supportive relationships, that they have opportunities to connect with others. They can recognize what others might be going through and when to reach out for help, but also to know that they have each other's backs. And then we prioritize emotional and physical safety. We've got breaks. We've got places people can go when they feel overwhelmed. We've got trusted adults who can support someone if they reach a point where they can't regulate themselves. And very importantly, we aren't looking to punish behavior. We're looking to understand it and create a response in the young person that gets their needs met in a more effective way. And collaborating with mental health professionals is important, especially if we're talking about high risk or crisis oriented behavior. We don't necessarily have to fix everything as trusted adults, but we have to be aware of what our organizational policies are, what our pathways are to get support. And we need to set boundaries where we are caring for both ourselves, but also young people know what those limits are. It can make you feel like you have to act as a caregiver or support or take over when a young person is struggling. And it's really important to know that boundaries make it more effective for you to do your job, but also for the young person to understand where those limits are. Limits create safety and expectations, and that's really important when a young person has gone through a traumatic life situation. Next slide.
I
All
can
right,
take over from here, John, if you want.
perfect.
And I know we're kind of getting close to the end of the didactic time, so I'm going to go through the next few slides fairly quickly. Hang in there with me. And as we're kind of transitioning into what are some of the things that you can do, we definitely want to think about setting those healthy boundaries because those will increase safety and security for the young person that you're working with. When they know what to expect, then they can anticipate that a little bit better. And that consistency really helps build comfort and trust in young people, which is really important. So you want to make sure that you're informing youth ahead of time of the things that you need to report, things that you might have to take to another adult to let them know what's going on. And then that's going to create less disruption when you might have to do that. When we think about communication, we want to think about doing that in a trauma-informed way as well. So making sure that we are in control of our emotional reactions in that moment. That might mean that you have to take a few moments ahead of time or ahead of having that conversation or maybe even debrief after, but really thinking about how you're presenting yourself to that young person, using that soft tone of voice, mirroring their body language, getting on their level is really important. Trying not to take anything personally. They are going to throw power struggles at you because that's part of their nature in working through something with trauma. And youth just in general, oftentimes. And so trying to avoid that and giving physical space between you and the child, not backing them into a corner, not making them feel trapped, and then save any consequences and debriefing for a later time when you're trying to have something communicated to them that they might need to follow through on. When you might face difficult behaviors, think about skill, not will. What are the ways in which you can focus them towards the things you want them to do, not the things that you don't want them to do? So they're focused in on the things that need to get done. Recognizing steps in the right direction, giving positive affirmations, praise is huge. It makes a big difference, and it also gears them towards the behaviors that you want to see. Making sure that you're regulating, that you're supporting their regulation. And then I already mentioned checking your emotional response. And you probably will have to do that throughout that interaction, making sure that you're continuing to check in with yourself. When it comes to trauma and suicide risk, for all youth, suicide is the second leading cause of death among children ages 10 to 14. That's in the United States. It's the third leading cause of death if we extend that time frame for youth from 10 to 24. So it's a very significant factor in our work with youth in the ways that we might interact with them. And then we can see here that trauma does increase risk for young people. So it increases invalidation, likelihood of untreated mental health conditions, and the experience of loss, as well as decreasing social connectedness, life satisfaction, access to care, and resources. And then on our next slide here, we have several different experiences that youth might have that would increase that high risk, those subgroups. Certainly, I would love to go into each and every one of these, but given time, we don't have that. Communication is really important, making sure that you know that suicide risk is never something that you can keep a secret. Research shows that 60 to 95% of parents are unaware of suicide attempts reported by their child. So if we don't share that information, caregivers don't have the opportunity to help support that young person. So again, going back to boundaries, making sure that they know that that kind of risk we have to share. And then we've got kind of a slide here on empowering youth voice, building trust and connection, enhancing program effectiveness through youth-led insights, promoting resilience and agency, and then reducing stigma and increasing help-seeking behavior. And with that, we've got a number of resources here at the end of our slides that you'll have access to. So we've got trauma-informed care, crisis resources, some additional information from our team, and then the Kids Mental Health Foundation is a great resource that we use often. This is our direct contact information. And then with that, I'm going to turn it over to our ECHO team.
Thank you so much, Dr. Prater. That was a great way to conceptualize how to bring trauma-informed work into youth-led prevention. I love what Dr. Ackerman mentioned, that understanding trauma can help us understand why kids might be acting in difficult ways and that limits create safety. And I also loved what you mentioned, Dr. Prater, about the importance of adults having control over our own emotions before trying to help youth. Thank you so much. And thank you for keeping us on time as well.